Well, in the United States, statistics show that 61% of adults experience a traumatic event. Those events can be life-threatening and critical, where every second can mean the difference between life and death. That's something I know. I'm joined by Dr. Robert Maxwell, who has more on Erlanger's Trauma Symposium, but I must say that when you walked in, Dr. Maxwell, the first thing I did was just kind of look and then gave you the biggest hug, because I have to say that this is the doctor here who saved my life. So it's kind of emotional, so I don't want to really talk about that, because every time I see Dr. Maxwell and I think about that and how he saved my life with a traumatic situation. So Erlanger's having a symposium, Dr. Maxwell. And, you know, one of the things I talked about is this is a trauma symposium. Talk about, first of all, Erlanger, and when we talk about trauma, as I said, when the first EMTs and the firefighters came to my house, they said, we're going to pass by a couple of hospitals because we need to get you downtown to Erlanger. So talk about what you all do there and just how that is you know, played out as far as the level of trauma and when patients come there.
Sure, thank you, Latrice, and thanks for recognizing the Trauma Symposium and bringing us down here for a plug. It's the 15th annual Trauma Symposium, and as far as I know, probably the longest standing symposium out there. You know, Erlanger is a level 1 trauma center, and that means that we are prepared to provide the highest level of care to injured patients. And it's also a type of facility that provides multiple levels of higher level of care, not just trauma. And so when you were sick, that's why they took you to Erlanger, because they knew that you needed the highest level of care available. Being a level 1 trauma center, the big distinction is that you're involved with research and community education, and that's what the Trauma Symposium is about. Educating the allied healthcare providers in our community that may have a role in trauma care. Level 1 trauma centers are dedicated to staying on the cutting edge of research and what is available to improve outcomes. And we try and make sure that all of our healthcare providers involved with trauma are all on the same page. And the symposium is set up to bring some of the latest developments in trauma care, or the lectures and skill stations are designed to give a broader base of knowledge about what is happening in the world of trauma.
So how important is that, Dr. Maxwell? So when you're talking about staying on the cutting edge of what's available in trauma care and making sure that all of your allied partners understand that, you know, that everybody is on that same page, because you have this patient, and whether it's me or, you know, like all these patients that you see and work so hard to save their life every day, how, you know, everybody does have to be on the same page and know what's going on.
That's right. Like many complicated things in the world, it takes a village of people, and you need all the people in the village to be speaking the same language and familiar with what's going on. And the more the people involved with the care of trauma patients understand, I think it just helps the delivery process, and there's better buy-in when an individual understands why they're doing a certain activity or intervention for a patient.
Can you tell us a little bit, just, you know, just on the now when it comes to trauma, you know, every day, and just talk about, you know, what you see and just how critical every moment is?
Yeah, so as a level 1 trauma center, we have a trauma team that is on duty 24/7. We have triage criteria that we get from the pre-hospital personnel, and if they meet certain activation criteria, the trauma team reports to the emergency room, and we're waiting for the patient when they arrive. And depending on the mechanism and what has happened to the patient, we go into different algorithms to help stabilize and find immediately life-threatening conditions and treat those. And that's a lot about what the symposium does, is there's a lot of simulation for those sorts of scenarios. In the skills day, the second day of the symposium, we have a massive transfusion station set up. We have several airway stations that are set up. Airway is critical intervention in stabilizing a trauma patient. And we have a lot about the gross anatomy of the human body where people can learn more about.
And it really is, and I didn't want to cut you off, but I just wanted to point out two things before we run out of time. You talked about two things that I heard you say, talking about transfusion and the breathing, and so that's so important because yeah. I know. So, but remind people when this is taking place, Dr. Maxwell.
It's May 22nd and 23rd at the Chattanooga Convention Center, and you can go to erlanger.org and Trauma Symposium, and the registration is there, and there's more information, and there's pictures from previous symposia. So,
okay. All right. Well, we're going to make sure that people know about this. And again, Dr. Maxwell, thank you so very much. And so I just want to say again how glad I am to see you again.